Hello everyone, welcome to GrowMed. Welcome back to the session of discussing the most important topics from all of the subjects for the upcoming FMG, and this will be like a real quick revision kind of a video discussing all the important topics. So without wasting our much time, we will start a discussion. And before watching this video, do watch the part 1 video. The link will be given in the description box to boost your preparation. Okay, so the infectious diseases, these are very important, and frequently questions have been asked on this in integration with the micro. And these are the pediatric condition. The pediatric में भी पूछा जाता है. Then PSM also these questions are asked. Okay, so it is that important topic. So first one is the measles. So the causative organism is the rubiola, and the incubation period, this one is a PYQ. And another very important thing is the Koplik spot. So this is the pathognomic feature, and whenever you see this Koplik spots given in the question, blindly mark the answer as the measles, and the location is opposite to the lower second molar. As you can see here that these are the spots and these are the Koplik spots which are seen. Okay, so image based question can also be asked, so you need to be prepared in a way that whatever the question can be coming from the topic, you will be easily able to solve it. And another very important pathognomic feature is the Warthin Finkildi chained cell. So this is the image can be asked in integration with the patho. So this image can be asked in integration with the pathology. As you can see here that this is a multinucleated grape-like cluster seen, and the name is the Warthin Finkildi Jense. Then the rash, origin of the rash will be the retroauricular origin of the rash. See, if at all simple one-liner is asked, then you can easily be able to solve it. But if at all a clinical case they want to describe about the measles, then they'll be describing things like cough, coryza, and conjunctivitis. So 3Cs, and then the rash, then Koplik spots, and all these things will be described in the question, and they will ask you what is the diagnosis. So it will be the measles. Okay, so then moving on to the most common complication, it is the otitis media, and most common cause of death is the pneumonia. And the long standing complication seen is the subacute sclerosing panencephalitis. Okay, so these are the important things from the measles. Then moving on to the erythema infectiosum. So the causative organism parvovirus, this is a PYQ, and simple one-liners was asked, and it gives a slapped cheek appearance, as you can see here. So it gives a appearance of the slapped cheek. Okay. Then chicken pox, causative organism varicella zoster or the HHV3 other name. Okay. Incubation to 10 to 21 days hai, and the rash. So these are the features of the rash of the chicken pox. So it is centripetal and pleomorphic rash and dewdrop like appearance. So you can see here that this gives a dewdrop like appearance, and pleomorphic means at one stage only you can see multiple at one phase only you can see various multiple different type of rashes like papules. You can see even the macules, you can see pustules. Okay, so this is the characteristic feature of this chicken pox. And the congenital varicella syndrome, so history and rash in the mother, baby has the theatrical skin scars, lip abnormalities, and low birth weight. Okay, so these are the features associated with this congenital varicella syndrome. Then hand, foot, and mouth disease, the causative organism. Then the hand, foot, mouth disease, the causative organism is the Coxsackie-A virus, and Coxsackie. So this was a PYQ. A simple one line was asked, and so the characteristic feature is the oral ulcers and the palmoplantar pustules. See the name itself, you can easily come to know that mouth is involved, hand is involved, and the foot is involved. So these are the images given, and it is a viral infection. Okay, so this is the thing which you must remember from this hand, foot, mouth. Then mumps. The causative organism is the paramyvovirus, and incubation period is of 14 to 21 days. It is the important, and in my Telegram group I have shared a message or a flashcard regarding the incubation period for all the organisms. So do join the Telegram channel for the message, and you can find it there, so it will be easier for you all. Then fever, Parotid enlargement. See, this is the buzzword which will be given in the question. Most common complication in case of children, it is the aseptic meningitis. In case of adolescents, orchitis, and adult meningomyeloencephalitis. Okay. See, this complication wala jo question hai na, you need to look ki which age group they are describing. They are describing children or adolescent or adult, because it varies for all the three age groups, and accordingly you need to answer the question. Okay, so this was about the mumps and the parotid enlargement or the parotid swelling whenever it is given in the question. So think in terms of the mumps. Then rubella, so caused by rubella virus, incubation 14-21 days, mild exanthematous illness can be seen, lymphadenopathy, and so this is the hallmark feature of this rubella. So you can appreciate here these red spots present in the oropharynx, near the palate. So these are the forcimal spots, and these are the characteristic features of this rubella. So image based question can be asked, so do remember the image as well. Then this is also a repeat topic. Congenital rubella syndrome consists of the triad, and questions can be asked like all of the following are the components of the triad except, and they can describe one exception. So cataract, deafness, which kind? Sensory neural hearing loss, and CVS, most commonly PDA, patent ductus arteriosus. Okay, so congenital rubella syndrome key features. So these were some important infectious diseases which you must know. Then moving on to the vitamins. So already I've discussed a complete video on the vitamins, so the link I will be giving it in the description box, so do watch that video also. In this video quickly we'll discuss the PYQs asked from the vitamins. Okay, so vitamins, this is the source from where we get halibut and the cod fish oil and the vegetable mango carrot. So these are the doses which are required, daily requiremental, and the deficiency will be causing bite or spot and the xerophthalmia. So this is a image based question asked in integration with the even ophthalmology, biochemistry, and PSM also. Okay, so this is an important bite or spot, you need to remember it. Then this comes under the national immunization schedule also, so we will be giving vitamin A. So these are the doses of this vitamin A, and we will be giving it. So these are for the prophylaxis. Okay, and in case there is deficiency, then based on the age of the person we will be giving it 1 lakh or 2 lakh. And in the national immunization schedule, I think okay, I've not written it. So every we will be starting it from the 9th month onward, and we will be giving it every 6 months till the 5 years. Okay, so maybe I'm not able to recall exactly, but I think 9 months, 6 months, and 5 years. Okay, so this is about the NIS. Then this staging grading also you need to remember, because questions are asked in integration with the ophtha for this vitamin A deficiency. मतलब कि जो xerophthalmia है वो, what 1A stands for, what 1B stands for. This bite or spot wala तो is it is like a repeat topic, favorite question of the examiners. Then vitamin D. So D, these are the sources of the D. Then these are the daily requirements of the D. So the active form, this is the PYQ asked from the physiology. So physiology के integration में they had asked this, and deficiency, rickets, and osteoporosis, vitamin D supplementation, and the function ये भी पूछा गया था exam में. So this was also a PYQ. Then vitamin K. So this is the daily requirement of the dose, and the function. So this was a PYQ, the function of the vitamin K, and the forms also question was asked. And in the recent JAN exam also there was a question on this vitamin A. They had given some 4 sentences, and they had asked which of the following is wrong from the given options. Okay, so you need to be very careful while looking at the options, because they can be confusing. Okay, so the 3 important forms of the vitamin K, 1, 2, 3, phylloquinylminaquine on the midadione. So these two are the fat soluble, and this is the water soluble. Deficiency will be causing neonatal hemorrhagic disease. This is also a PYQ and must remember topic. Okay, so very important. Okay, then moving on to the vitamin C. So vitamin C is also very important, because questions are asked like it um, has a function in post translation modification of the collagen. Okay, so this collagen, if there is deficient, can cause bleeding and delayed wound healing. So this is the favorite question of the FMGs. So do remember this think that vitamin C is also correlated with the wound healing, delayed wound healing. So deficiency of vitamin C. And also vitamin C helps in the iron absorption, right? So this is also an important thing, and it acts as an antioxidant. Deficiency causes scurvy. Then let's discuss the vitamin E, and later we'll move on to the B complexes, because B complex is very important, and definitely you'll be getting one or two questions from the B complexes itself, and other than that other vitamins. Okay, so you can just expect 3 to 4 questions easily on these vitamins. Then function is the antioxidant, so quite easy, so simple hai. Just remember antioxidant vitamin E. So question was asked that which of the following is the most potent antioxidant vitamin, and the answer was the E. Then deficiency will be causing neurological disorders and hemolytic anemia. Okay, then B complex B1. So you need to remember the alternative name also, like the thiamine, then the riboflavin and the niacin, because questions can be like interconnected and they can be asked in a different way. Then deficiency will be causing beriberi, eating the polished rice, and chronic alcoholic causes in pernicious encephalopathy. So this is also quite important, asked in integration with the psychiatry, and questions are asked like द अल्कोहल, राइट, द अल्कोहल विथड्रॉवल में किस आवर्स में कौन सी वाली फाइंडिंग देखने को मिलती है करके, एंड दैट कम्स इन द साइकेट्री. देन रिक्वायर्ड फॉर द ऑक्सीडेटिव डिकार्बोक्सिलेशन एंड द मार्कर वाला, दिस इज इंपॉर्टेंट. सो PYQ, दैट मार्कर फॉर द deficiency of the B1 is the transketolase. And if a clinical case is described, like a patient with the features of the beriberi and he has consumption of the polished rice, so the answer will be the thiamine deficiency. And another important thing is that beriberi classified into two types, so dry and wet. So in case of wet, no, there will be involvement of the heart and the CVS will be damaged. So this was also a question asked. I don't remember the exact question asked, but there was these things described about the heart failure, and they had asked what is the cause. So the answer was the wet beriberi. Then B12, so riboflavin and deficiency causes angular stomatitis, chillosis and glossitis. Okay. So whenever you see a clinical case describing these things that affecting the tongue, and uh, tongue may redness, then swelling around the tongue and all those things, so the answer will be the vitamin B2 deficiency. And the marker, this is important, asked as a PYQ one liner. Then B3 niacin deficiency, this is a must do topic. Matlab I used to give it 5 stars because you just cannot miss it. And like this image, this image is asked in all the exams. B3 deficiency causes pellagra, 3Ds, diarrhea, dermatitis, dementia, and if do not treated properly, then death of the patient. Most common, maize eaters. See, polish rice, B1, maize, B3. Then precursor is the tryptophan, that is tryptophan will be helping in the formation of the niacin. So this is also a must do topic. Then B5, not that important, just remember that it is a cofactor for the coenzyme A and it causes burning feet syndrome. Then for B6, so the important thing from B6 is peripheral neuropathy, because it will be causing tingling sensation, and a clinical case was described that a patient with so and so symptoms and he had peripheral neuropathy, which vitamin E will be deficient in the patient, so it was the vitamin 6. And this is required for decarboxylation, protein metabolism, glycogen phosphorylase, and marker is a transaminase, so this is also an important thing, marker. Then this is also a repeat topic, B7 biotin, so deficiency will be causing alopecia, and whenever you see this combination described in the question, alopecia, raw eggs, just blindly mark the answer as the biotin या फिर B7 deficiency. And they can also describe like gym, boy was going to the gym and for the development of the body he started eating raw eggs and comes with a complaint of alopecia. So this is the classical case which is repeatedly asked of this biotin. So I've discussed the case also and what kind of question can be asked also. Okay, then it also causes multiple carboxylase deficiency. because it is required for the carboxylation. No, so whenever there will be deficiency of this biotin, so multiple carboxylase deficiency can also occur. Then B9, which is the folic acid, and one important thing is the neuric tube defects. So this is the question asked in integration with the OBG also, that for and anatomy also, that folic acid deficiency will be causing neural tube defects, and it can also cause megaloblastic anemia, and this is the dose required in case of the pregnancy and high risk pregnancies. Okay, so these were both also PYQs to prevent the neural tube defects, how much dose you will be giving. So it was the 4000 microgram, and they can also describe a clinical case. ठीक है, तो पूरा full fledged clinical case अच्छे से सजा के बना के आपको present करेंगे, but in the last line they'll be describing one single sentence that neural tube defect prophylaxis के लिए how much folic acid you will be giving. मतलब you will be reading the whole 4 or 5 line clinical case, and in the last only the question will be there. मतलब ये तो पूरी story हो गई ना. So in exam also, for saving your time, try to read the last word first, and then later if you don't understand what the examiner is trying to ask, then read the full question. See, इसमें इस केस में कैसे था कि in the last only you will be able come to know ना कि what examiner is trying to ask, so you will be time saving. So this was a one trick or a tip which you can follow in the exam hall. सो नेक्स्ट इंपॉर्टेंट ब्रेन हैमरेज, श्योर शॉर्ट वन टॉपिक. ठीक है, वन क्वेश्चन, मतलब अगर आपने इतना पढ़ लिया ना तो वन क्वेश्चन आप समझ लो कि आ गया आपका, एंड इसमें भी 3 या 4 क्वेश्चन आपके आ गए इजीली. So the brain hemorrhage classified into various types based on the pattern seen on the chest x-ray, and one important thing you need to remember is initial investigation of choice for the hemorrhage will be the NCCT, and in case of question can be asked like a trauma patient with trauma, he is unconscious. ठीक है, and investigation of choice will be NCCT. So these are the x-ray images, and the EDH, extradural hemorrhage, then subdural subarachnoid, and then the parenchymal hemorrhage, and then the ventricular hemorrhage. Okay, so these are the various types, and the most common cause of the extradural, subdural, and this subarachnoid is the hypertension. Subarachnoid hypertension is the most common cause, whereas others are the trauma. An important thing which you must remember from this EDH is the lucid interval. So whenever you see this lucid interval, mark the answer as the EDH, and the site is the middle meningeal artery which will be bleeding, and the site is the pterion. Okay, so you need to remember these things also, and this is the X-ray finding. So this idli shape so the idli shape thing which you can see, idli shaped hemorrhage, this one is the classical finding with the EDH. Then for the subdural, so it can be remembered like lens and biconvex also. For subdural, it is the bridging veins which are damaged and bleeding occurs from there, and the crescent shape. So you can see here that it looks like a half moon shape, crescent shape. That one you can remember it. Then subarachnoid hemorrhage, so the most common cause is the hypertension, and bleeding occurs from the circle of Willis-Berry aneurysm, it is called, and star of death appearance. So you can see here this the star. Okay, so this one is seen with this subarachnoid hemorrhage. Then in the clinical case, if they want to ask about the subarachnoid hemorrhage, they'll be describing something like a patient, he was either hypertensive करके दे देंगे या फिर trauma करके दे देंगे, and a patient will complain of the worst headache of their life, which is also called as a thunderclamp headache, and then the answer will be the subarachnoid hemorrhage. Then parenchymal, most common cause is the hypertension, most common site is the putamen, PYQ it was asked. Then a question can be described like hypertensive patient coming to the ER with complaint of weakness in the arm. So what is the cause? So it will be the parenchymal hemorrhage, or if they ask site, it will be the putamen. Then interventricular, so blood accumulated in the ventricles, as you can see here, and whenever you see this, no, these are the CT scans. Okay, on the CT you can see here that blood will be coming, this one is CT, all this is CT, and the blood will be hyper dense. Okay, the blood will be hyperdense, whereas the CSF fluid, it will be hypodense. That means it will be appearing black color, whereas blood will be appearing a white color. But these, okay, so these were about the brain hemorrhages which you must know. Then moving on to another very important topic, that is the pneumothorax. And pneumothorax means air which is filled in the lungs and the pleura. Then there are of three types: open, closed, and tension. So this tension wala is a very important, and questions are asked like describing a case of the tension pneumothorax, and they will ask the management. So we all know that management is the ICD insertion, fifth intercostal space. So just remember this one right now for this uh, tension pneumothorax, because comes in integration with the surgery and the medicine as well. And the clinical features will be described like sudden onset respiratory distress, absent breath sounds, then uh, cyanosis, trachea deviation, hypotension, and tachycardia. So these things will be described in the clinical case, and they will ask what is the diagnosis, or either what is the investigation in management of choice, and x-ray. So can be asked in integration with the radio also giving the chest x-ray. So as you can appreciate here, that this is the white line seen here, and this is the lung which has collapsed, and this accumulation of air here which is giving a brighter darker appearance. If you appreciate here, here it is normal, you can also see the airway markings, but here you cannot see the markings. So this is the x-ray of the pneumothorax. And the other findings which you can see here are the air present, like more blackening present, so it will be the air. Lung is collapsed, you can see here the lung collapsed. Then trachea is deviated, deep sulcus sign seen here at the angle of the costophrenic angle. So these are the important findings of the pneumothorax. Then another important thing related to this is the subcutaneous emphysema, which occurs due to a pneumothorax, and it is the periorbital puffiness. So this is an image based question asked in the surgery in the past year, so it is also important. And they can also ask like giving this whole image, and they can ask what is the cause. So it will be the pneumothorax or subcutaneous emphysema. Then management of the pneumothorax, needle thoracocentesis, ICD. So this matlab I can assume that almost everyone know about this management for the pneumothorax, because it is a must know and a repeat topic. Then a clinical case of the pneumothorax, tension pneumothorax, will be described like history of rib fracture or trauma or road traffic accident. Presents with respiratory distress, hypotension, and dilated neck veins. What will be the diagnosis? Tension pneumothorax. So now let's discuss some important ENT topics. So the first one is the laryngomalacia. So this is also a repeat topic, comes in integration with the pediatric also. So that's why it is very important. So the classical finding seen is this omega shaped epiglottis. So whenever you see this omega shaped epiglottis, just mark the answer as the laryngomalacia. And the most common cause of the stridor in the infant, and the characteristic feature of the stridor is inspiratory stridoritis, and it is present from the birth itself, increases on the crying and decreases in the prone position. And clinical features will be described like cough, choking, weight loss, and dysphagia in the clinical case. And along with that, they can either give some findings like stridor is present or omega shape epiglottis, or they can give image to make the question look easier. Okay, so by looking at these things, you will be coming to know the diagnosis as the laryngomalacia. Then diagnosis we will be doing by flexible bronchoscopy. Conservative management we will be doing because it is a self-limiting condition and resolves by 2 years of age. Okay, so these were the things from the laryngomalacia. Then nasal angiofibroma. So it is a vascular tumor. So nasal comes from the nose, angio blood vessel, fibroma tumor, ठीक है, तो it is a tumor of the blood vessels. Benign tumor of the nasopharynx arises, so this is a PYQ asked, that arises from the sphenopalatine foramen, that is the lateral nasal wall, most commonly seen in the adolescent boys. And clinical features will be nasal mass, profuse, recurrent epistaxis, and investigation of choice, Holman-Miller sign, this sign, Holman-Miller, anterior bow wing of the posterior maxillary wall because of the vascular tumor. So this vascular tumor is pushing this wall towards the front, giving this sign, and this is a hallmark feature. PYQ can be asked, image based question can be asked. Then if a clinical case is described, if a क्या मतलब clinical case तो आएगा ही आएगा इस पे, because it is like the repeat topic nasal angiofibroma, and clinical case में they will be describing like a boy described something between 8 to 15 years, comes with nasal mass and epistaxis, recurrent epistaxis, and what will be the diagnosis. बस ये तीन चीज़ें ही enough है इसको diagnose करने के लिए कि ये nasal angiofibroma होगा. And if at all they give this other findings like the Holman Miller sign, that तो फिर पक्का श्योर ही होगा कि ये nasal angiofibroma है. Then other feature seen is the frog face deformity. So you can see here that due to the you can see here na, that a mass is coming from the nose and the face it looks like a frog. Then treatment of choice is the endoscopic excision. Then ophthalmology important is the retinoblastoma. So this retinoblastoma can be asked in integration with the patho because chromosomal की condition है ना, जो chromosomal abnormality है 13q14, तो it can be asked from there. Then retinoblastoma because from the ophthalmology. Pediatric में पूछ सकते हैं. Okay. Then most common tumor in the children, most common intraocular calcification. So whenever you see this intraocular calcification, then in the options retinoblastoma is given, then mark that one as the answer क्योंकि यही होगा cause, most common cause retinoblastoma in the children. Then RB1 gene will be affected, important from the patho. Then clinical features are the leukorrhea, squint, inflammation and the uveitis. Investigation of choice MRI, HPE histopathological में Flexner Winters rosettes, and this is also important from the patho. Treatment laser, photocoagulation and chemotherapy we will be using VEC, and most common metastasis is the optic nerve. So this was a PYQ. Simple one liner was asked that most common site of the metastasis of the retinoblastoma is the optic nerve, and this is the image which can be given in the exam, and you can easily come to know that यहाँ पर eye में you can see something white reflex, so they can also describe like white pupillary reflex is seen, तो वो भी they are describing it in terms of this retinoblastoma. And if they give this image also, it will be easier for you all to reach to the diagnosis. And this is the image of the Flexner Winchester rosettes and well defined lumen surrounded by the columns. See, this is the lumen which is well defined, so we can easily appreciate it, and surrounding to it the cells are present. So pathology के relation में they can just ask like giving this image also, they'll ask what is this image करके. Then moving on to the cataract. So these cataract are also important, and you can definitely expect one question from this cataract, and the image based question are asked on this cataract, giving the image, and they'll ask you what is this image, which type of cataract it is, or they can give a clinical case describing all the things and then the image, so that will be easier for you all. So the Xmas tree cataract seen in the myotonic dystrophy, snowflake diabetes mellitus. One second. Yes, it is seen in the diabetes mellitus, uncontrolled diabetes mellitus. So you can see here that snowflake like things will be visible. Then the sunflower cataract seen with the Wilson's disease. Wilson's disease is a very important topic. So it is due to the increased copper deposition, and there's also the mutation present. So mutation is the ATP B something like this, ATP7B, ATP7B mutation. So this is a mutation associated with this, and the copper gets deposited in the lens, giving this cataract, sunflower cataract. Oil drop cataract must know. So this was a PYQ asked in integration, so with the biochem, and they'll be describing all the features of this galactosemia, and they'll give a hint oil drop cataract was visible. So straight away go and mark the answer as the galactosemia. So this is also a reversible kind of the cataract. Then rosette cataract seen in trauma. So this is also a repeat topic, and I've seen this question like in most of the papers, like past years. When I was analyzing them, this rosette cataract wala question, it was there in all the papers, and in the Jan 24 also the question was there on this rosette cataract associated with the trauma. Then Vicious ring, so it is also the bleeding. It's not the cataract, it's bleeding, and due to the bleeding a ring will be formed, and that one is also due to the trauma. Then this is the Morgagni cataract, also called as the hypermature cataract, and this one is the coralliform, which is the congenital form. Okay, so this was the images. Now questions are asked on the cause and also on the stages of the cataract and also on the treatment. So see, it is the most common cause of the blindness, and this was a PYQ. One liner was asked, and based on the morphology classified into three types: nuclear, cortical, and subcapsular. Okay, so important finding associated with the nuclear is the second sight, and it causes index myopia. Then nyctalopia, cortical causes nyctalopia. See, nuclear मतलब कि the cells which are cells नहीं मतलब the accumulation of the products will be in the center. So center में क्या होता है, रेटिना पे center में कोन्स प्रेजेंट रहते हैं ना, एंड कोन्स आर एसोसिएटेड विद द डे टाइम in sight. So daytime sight will be hampered in case of this nuclear, whereas in cortical the rods are present in the periphery. So if a cataract appears here like this in the periphery, then the rays will be blocked of the periphery, causing nyctalopia. Okay, so I hope you have understood about the concept behind this nuclear and the cortical. Then posterior subcapsular caused by the steroids, radiation, and the complicated cataract. So this one is an important thing. All except kind of a question can be asked. So you need to remember these things: that steroid, radiation, and the complicated cataract, these causes posterior subcapsular cataract. And these are the other types based on the cause. So congenital, then traumatic rosette we have already discussed. Then complicated, so these are the features of the complicated, and this was the PYQ. So all of the following are the features of the complicated cataract except, so polychromatic luster, opacity, spread axially, and the posterior subscapular. So now drug induced, so steroid induces, then chlorpromazine, and chloroquine. Chlorpromazine causes stellate cataract. Then metabolic, based on the metabolic diseases like the sunflower oil drop and sunflower, as we had already discussed, diabetes mellitus, then galactosemia, then Wilson's disease, all those things. Now stages, so classified into the incipient, which is the early, then immature, mature, and the hypermature, and this is the findings which can be seen in that particular stage. So these are the treatment options available, and this is the surgical steps. So you need to remember the surgical steps because questions are asked like in the sequence how you will be doing the lens surgery. Okay, so that's all in this video, guys. In the next video I'll be discussing more important things from this, so that you'll not be missing any repeat topic, and if at all the question comes, then you'll be easily coming by solving that question, and you will be making it correct. Okay, so thank you so much for watching this video. Once again, watch the part 1 video and stay tuned for more amazing videos related to the FMG. And if you're new to GrowMed, subscribe to GrowMed, join with me on the Telegram. I am Dr. Padmini, your mentor for the FMG, and once again, thank you so much.